So let's talk about how to talk to loved ones about how they're doing. I'd love to start our meeting today with a brief little mindfulness practice that you can actually use with young people in your life as well. So, first, just take a moment to ask yourself how you're doing. You can use any kind of feeling words like happy, excited, tired, overwhelmed, sad, maybe a scale of 1 to 10. Just how are you doing right now? Now, I'd like you to find a comfortable seat and you can rest your hands wherever they feel nice. You can look straight ahead of you, maybe gaze down at the tip of your nose, or if you feel comfortable, you could even close your eyes and just take a deep breath in through your nose and hold it. And then let it out through your mouth. Do that one more time. Take a deep breath in through your nose, holding it, and letting it out through your mouth. Do that one more time at your own pace. Then one more time, ask yourself, how are you doing? You might feel exactly the same, or just taking that moment to take a breath and come back to the present moment might have given you a little bit of extra relief. So, now let's talk about some strategies and tips for helping others talk about how they are doing. And you don't need to take any notes today because you'll get a tip sheet after today's presentation that's going to go over everything that we're going to talk about now. So, the first thing that you can do as an adult is to create an environment where your family feels safe to share their feelings. That can start with sharing your own feelings and experiences. By the time we reach adulthood, we've all overcome at least one challenge in our lives. And it's important that younger people hear us tell these stories and show how we have overcome our own struggles. Especially with COVID, we've all had those moments or weeks where we feel very overwhelmed or stressed or isolated. And you might feel some pressure to put on that brave face and feel like you're taking care of your family and you're holding everything together. But this can give our children and other young people in our family the idea that they have to always hold themselves together or take care of everything without expressing how they feel. So, just giving our children and other young people we know an insight into how we're also struggling and using certain coping skills we have to try to overcome those struggles can be really powerful. And whenever we are having these difficult conversations, it can be really helpful to leave the end of the conversation with a hopeful tone where we talk about what skills and what strategies we use to deal with those feelings that we have or overcome those challenges. Sometimes it can be helpful to adjust our routines to specifically make time in our days to have these conversations. So, with young people in our families, if we're seeing them consistently every day, it might be on the way to school or on the way home from school, maybe at the dinner table or right before bed. If it's a family member where you talk to them once a week, maybe carve out a little bit of time at the beginning or end of the conversation to just check in about feelings. There are lots of different ways you can do this. You can just ask, how was your day? Maybe, was there anything different that happened today? What challenged you today? Or even a conversation about what they learned that day can lead into some discussions about feelings. However, not every young person is going to want to just come out with their feelings, and doing other activities that help us express our emotions can lead to these conversations. Maybe while you're drawing or dancing or doing some other kind of art activity, you might be able to tap into talking about emotions. And during these conversations, sometimes difficult emotions will come up. So it is really helpful for us to have a follow up plan for when difficult emotions are shared. So perhaps we might want to make sure that we have some kind of stress relief practice, maybe a mindfulness technique like breath work, like we just did, meditation, visualization, yoga, or some other kind of mindfulness practice to do right after we have one of these big conversations. You might also, if you know your child or the young person you're talking to has been struggling, you might want to have some information on hand about mental health professionals in your area that you could reach out to if the child is feeling very triggered or wants to take that next step and get some clinical help. It could also be helpful for you as an adult in this young person's life to get some training in mental health awareness for yourself. Mental health first aid offers free in person training when it's safe. I believe they have online training right now as well. To anyone in the community, often you have to get a group of folks together to get a free training or perhaps join another group's training. Also, the Mental Health Technology Transfer Center, where we're coming to you from today, we have a catalog of free training videos, toolkits, and tip sheets. Most of these are geared toward the mental health professional community, but can be really helpful for family members as well. There are often community based organizations that can give you resources as well. And most schools have at least a counselor or a school mental health provider, like a school psychologist or social worker, who can give you some specific resources about whatever anxiety or depression or other mental health challenge your child or youth is dealing with. Another great way to improve mental health awareness is to model how other family members can talk to this young person when you're in conversation with them as well. So, some of these tips and tricks you learn from mental health first aid or other resources that you find, you can use these in conversation with your spouse, your partner, siblings, anyone else in your family. And then once you gain these tools, share them with the rest of the family as well. There are specific different youth friendly language that we can use to teach young people about how their environment affects their emotions and what stress and trauma does to the body and the brain. We can use growth mindset to help young people see that challenges and failures are actually learning opportunities. And I'm going to have a link in the tip sheet I share with you that has specific ways that we can change the way that we praise our children so that we're cultivating this growth mindset, which helps them understand that even if they don't know something right now, they can learn it. It helps them understand that just because they don't know how to do something right now, they have the opportunity to learn and practice and get better at anything. It's also important to build trust with our families. We can do that by doing collaborative activities like arts and crafts projects or puzzles and team based games. And then we also can look at specific language that's developmentally appropriate to talk to children of different ages. So I'll have some links in the tip sheet about how we can talk to preschool children versus elementary school children versus teenagers, because the language that we specifically use is going to be different for children of each of those ages. For young children in particular, we can help them understand how to name their emotions and how they show up in their bodies. So, a lot of the times when a child has a consistent headache or stomach ache, that can point to anxiety. So, we can talk about when they are chronically complaining about a pain in a certain part of their body, we can start to connect those emotions to those physical feelings. Using storybooks can be a powerful way to start the conversation about emotions by just asking how the characters felt after certain things happened in the story. For older children and younger children, it's important for us to talk to our school about what they are doing to support youth mental health. So, peer support programs can be a really great way for schools who are a little bit understaffed to look into supporting youth mental health. And I'll have some links for some formal peer support programs that parents and families can recommend, or even doing informal buddy systems can be really great as well. And then right now, one of the biggest buzzwords in education is social emotional learning, because we're all recognizing that Children just cannot learn reading, writing, and math until their brains and bodies are ready to absorb that information. And so, social emotional learning is really key to having a holistic education. So you could directly ask your teachers and administrators at your child's school what social emotional skills they're teaching, what programs they're using. And if they're not, you can recommend some. I've got a link in our tip sheet to Castle's program guides, which looks at elementary, early childhood, and secondary programs and analyzes them for how effective they are and what skills they teach. So those are all great ways to help your family and your child's school talk to them about how they're doing.